Hi, everyone, and thank you so much for joining us for this tobacco cessation learning community webinar entitled Promoting Tobacco Cessation in Your Tribe's Community. This webinar will feature some tips and best practices for engaging in this area and creating systems change in our communities. I'm Brett Weber, Public Health Policy and Programs Manager with the National Indian Health Board. And today's speaker will be Rae O'Leary, who is a member of the Turtle Mountain Band of Chippewa. And Rae conducts research and leads public health initiatives for Missouri Breaks on the Cheyenne River Sioux Reservation. Rae has led the Chonlee Coalition for the past 12 years, and it was her leadership that influenced the Cheyenne River Sioux Tribal Council to pass one of the strongest smoke-free air policies in Indian country. She also had the opportunity to testify to the United States Congress on the youth e-cigarette epidemic and Juul's attempts to target Native people, specifically Native youth. Rae served on the Public Health Task Force for the tribe throughout the COVID pandemic as well. Before we get started, just a couple of housekeeping tips. We will have folks muted while Rae is speaking just to reduce background noise, but we will have time for discussion, question, and answers after her presentation. If you want to write your thought down so you don't forget it, you are welcome to put it in the chat. The slides on your screen will be sent out after the webinar. I know that's usually everyone's first question, so we will send out those slides after the webinar, and we will also ask you to fill out a brief evaluation. That evaluation takes about 2 minutes, but it helps us at National Indian Health Board provide information and topics that are relevant to you as tribal public health officials. This webinar is being recorded if you didn't hear the little beep at the beginning, and it will be available on NIHB's website in the coming days. So that's it for housekeeping, and I'm going to turn it over to Rae now.
Thanks, Brett. And thanks everyone for spending the next hour with us. Tobacco cessation is ever present on everyone's mind, especially people that have somebody they care about who uses tobacco, or maybe they use tobacco themselves. And that is because of the COVID pandemic. We've learned as the year has gone on that individuals who are tobacco users have higher risk associated with COVID-19. So I see some familiar names in the participation list, but I see lots that I've never heard of before. So we're just kind of start by covering the basics of the background of the Chonlee Coalition, and then get into some more specific examples of what the Chonlee Coalition has done to promote tobacco cessation that you could potentially apply to your own community. Let's see here, my next slide. There we go. So the objectives of participation in this is that you'll be able to identify ways to incorporate cultural lifeways into tobacco cessation strategies, as well as identify PSE or policy system environmental changes that could support tobacco cessation in your tribal community. So kind of a background of the Chonlee Coalition, like Brett said, I've led it since 2009, but I don't do any of this work alone. I have a really strong membership of coalition members who are by my side every step of the way. Our initial goal was to make the state of South Dakota, to accompany the state of South Dakota's smoking ban that passed in 2010 with our own tribal smoking ban in indoor public places. Because of tribal sovereignty, the state laws don't apply on the reservation. So that was the rationale or the need for our own kind of grassroots movement to do this work. We partnered with the Public Health Law Center, who was very gracious to help us to draft the actual language of the ordinance. And they are a phenomenal resource. If anybody is doing any policy work that's related to public health, definitely check out their website and their services, because we couldn't have done this without them. So in May of 2015, after a lot of work, that's 6 years from the beginning of our coalition, beginning to actually being successful and getting a smoke-free air ordinance passed. At one point, we looked back and kind of quantified the amount of work that happened in those 6 years. That included 72 coalition meetings. We met once a month, 50 or more coalition members that have kind of come and gone over the years. 6 years of continuous tobacco prevention messaging and education to the community. And of course, much of that did involve tobacco cessation. 3 media efforts to recognize smoke-free businesses. So that was just kind of an effort of, we can't get the policy passed yet, but we'd like to acknowledge all the businesses that are already smoke-free in our community and encourage people to give them their business. We had to go through 3 legal reviews with the tribal attorney because too much time had passed, or the attorney would change. It was for a while kind of, it felt like anyway, council's way of just deflecting and saying like, okay, here's another hoop to jump through so we can push this off. And then we went through 12 presentations to the Tribal Health Committee, which is the process that we have to go through in order to get to full council for consideration of the policy. So it was a lot of work in those 6 years, but like I said, we were eventually successful, and we have a very strong, well-enforced, comprehensive smoke-free air policy now for the Shiner Sioux tribe, which is located in South Dakota. So early on in our coalition work, we developed a vision statement, kind of the big pie in the sky goal that we wanted to achieve, and that was to eliminate tobacco-related disparities on the Shiner Sioux tribe. And the goals that we kind of how we plan to get there was to first protect the community members from the dangers of secondhand smoke, prevent youth from initiating tobacco use, promote tobacco cessation, and reclaim the use of traditional tobacco. And you can see that, you know, this is definitely a multi-generational approach when you look at the youth individuals who maybe aren't yet tobacco users, who you just want to get them the information so they can make an informed decision when they have that first opportunity to say yes or no to try and commercialize tobacco. The cessation, that targets more of the current tobacco users to support them to be successful in quitting. And then the traditional tobacco is kind of a, I mean, it can also be looked at as cessation, because basically we're trying to get individuals to use that instead of the commercial tobacco, especially for those traditional or ceremonial purposes. So today's presentation is mainly going to focus on the cessation piece of it. So this is a framework here that the Chunli Coalition developed based on all of the years of work that we put into our policy efforts. We had a variety of different tribes reach out to us and say, hey, we really, you know, are excited about what you've done, and we want to do the same for our own tribal community. So what we did is kind of did a look back, and we're able to kind of organize all the different efforts that we did to be successful in that policy advocacy into this framework here. So you can see that the cycles of this framework are continual and really never ending. Missions and visions, you know, can change over time, but the coalition, the program, the policy has to be self-sustaining. One kind of key feature to this framework is that cultural lifeways are embedded throughout the framework. Anytime you are doing any kind of activity or initiative, it's really important, whether you're on a tribe, in inner city, urban population, to think about what is the culture here and how is that incorporated into our work, so that the local community can actually feel like, okay, this was made for us by people like us, because it's going to be so much more successful if you can do that. So you'll see in the policy framework, or the public health policy framework here, that there's 3 components. There's the education on the left, there's community engagement in the middle, and then there's policy on the right. And these arrows are meant to just, like I said, never ending, just kind of continue on. Depending on where you're at in your community and what your goals are, you might only focus on education and community engagement. You might, if you have different goals, only focus on policy and community engagement. But the key part is, because these circles overlap, community engagement has to be a part of all education efforts, and community engagement needs to be a part of all policy efforts in order to be successful. So there is a toolkit that accompanies this framework that we've developed in the past few years here, that's available to anyone who might be interested in one of these aspects and how this framework works in more detail. But this is kind of what built the foundation of all the work that we've done, and many of the tobacco cessation initiatives fall in various parts of this framework. So I guess the first step is to identify your team. That might just be a couple key champions, potentially you. Another good partner to consider if you're in the region of an IHS facility would be to find out who the GIPRA coordinator is for the Tobacco Cessation Division. If you're not familiar with GIPRA, it's a federal standard that IHSs have to report on. And they have, there's like a diabetes GIPRA, there's tobacco cessation GIPRA, there might be a heart disease GIPRA. But basically it's a way for them to quantify how good they're doing in that area. And that might be just a national person who is either passionate about tobacco cessation or has kind of a commitment due to their position at IHS to be devoted and monitoring the tobacco cessation. Other potential key champions might be an elder or a youth, maybe somebody who's been successful to quit smoking and wants to share their story. So kind of thinking who that might be in your community, and maybe it's you. Having a multidisciplinary team will help. They don't. Not everybody needs to be, at every meeting and leading all the charges, but having a very diverse team will definitely help in your efforts to promote tobacco cessation in your community. So on the right here is an example of a power versus interest grid. This is something that I learned in my public health training that's been super helpful, that I use frequently. So basically how this works is you have to think about, on this axis, who has high interest in tobacco cessation and who has low interest in tobacco cessation. And left to right, you think about who has low power to make a change or high power to make a change. So in terms of tobacco cessation, somebody that has high interest and high power might be the pharmacy department, or even a private pharmacy in the community, the behavioral health program, who also sometimes focuses on substance use, and your state quit line. And there is a national quit line program. So every single state in the United States has a quit line program that oftentimes, if you have a high portion of Native people in your state, they might have a special interest, I guess, in supporting that population, which is there for a reason, because we have generally higher rates of tobacco use in Native populations. Then if we think about the total opposite, so that's somebody that has high interest and high power. So maybe somebody who has low power to make a change and also low interest in tobacco cessation, but still has a seat at the table, or should at least be consulted in the process. That might be your women's health department, the emergency room, medical records departments, or even billing departments. So there are people, especially if you're going to be making system changes within your healthcare facility, those are people that need to be at the table when changes are discussed. So let's move up to this orange now. This is people that have a lot of interest, but not a lot of power to do much changes, would be maybe dental or diabetes programs. And that's because tobacco use definitely impacts oral health, and diabetes also impacts, or tobacco use also impacts diabetes. So those are people that are probably going to be really interested, but might not have a lot of power to make change in their role. And then if we go kitty corner here down to the blue, somebody that has low interest but a high power to make a change would be pediatrics departments. And I put them there because I think in pediatrics, that's a great place to not only work with the kids, but to work with the parents and the caregivers that are in the hospital with the kids, or even the clinic. Because kids have a lot more to lose when it comes to tobacco cessation and prevention, because they have their whole life ahead of them. So if they're exposed to tobacco as a child, that's going to impact them their whole life. If they start using at a young age, that's going to impact them their whole life. So that's kind of why they're more of a higher stake group. Nurses or aides are another high power group that might not have a lot of interest in cessation, but they have a lot of power because they have the closest interaction, or those daily cares with inpatients. And then CHRs, I don't know if it's something that you have in your community, but in ours here, they spend a lot of time on the road with patients, where it's a great opportunity to have conversations about their tobacco use. Cultural leaders, same, have a lot of power, but maybe not a lot of interest in tobacco cessation. But if you can get somebody in that category of being a cultural leader in your community, they can really make a big difference to support people who have tobacco addictions. And then the CAC, I don't know what that stands for, but I know they do a lot with the electronic medical records and IT. They can be really helpful, especially with system changes when it comes to the electronics within healthcare systems. But again, not a lot of interest. You kind of got to get them on board. So that's kind of thinking about who in your community might be a good partner to support the tobacco cessation efforts that you are hopefully going to be considering by the end of the presentation. So the next step would be to educate your team, train and retrain current staff on the 5 A's. There's also variations of the 5 A's. The 3 A's is what we use locally here. That's ask, advise, refer would be the next one. And then there's more lengthy versions of that. But because we have a really great South Dakota Quitline program in our state, oftentimes we let them do the bulk of the work. We just get them the patients so the Quitline can do their thing to support people that are interested in quitting. Then orienting any new staff to tobacco cessation, making sure that there's information available, that if there's maybe some required trainings that are available so they can kind of learn about both how tobacco cessation works at a facility, but also what's available in your community for tobacco cessation. I think I clicked too soon. There we go. And then what to include would be any data that you have that's specific to the local community, or even maybe regional if you don't have local data. And those available resources could be information on what does your pharmacy have for cessation medications. Do they have the number and the referral process for state Quitline information? Are there in-house behavioral health or substance use counseling programs that might support individuals in quitting addictions to commercial tobacco? And then the last one would be billing and coding for tobacco cessation. There are specific codes that they can bill for nicotine dependence, and exposure to tobacco would be one that's used more in pediatrics if there's a child that's exposed to tobacco. But it's really important that they are capturing that in their documentation for any visits. So you can see on the side here, this is a screenshot of a handout that we put together with our local data. And this is something that every year we present to the staff, whoever we can get, whether that's nurses, providers, pharmacists, dental hygienists, anyone who might have a stake in the game when it comes to tobacco. And you can see that the most recent data that we have for Cheyenne River, that 51% of our adults are tobacco users. We share information on chewing tobacco and vaping in youth and traditional tobacco use. We know that here about 30% of our community or adults in our community use tobacco for prayer or ceremony. But of that 30%, 70% of them use chinchasha and 30 use commercial tobacco. So that number is one that we hope to drive down, that through our education, we are promoting people only use chinchasha or the traditional tobacco for ceremonial purposes. And then there's also some information we include on secondhand smoke exposure. So that's kind of just the education piece, and something that, if you've ever done any American Indian adult tobacco surveys in your community and can get your hands on that data, you'd pretty much be able to create a report really similar to this. If not, other good sources would be the Youth Tobacco Survey that's done nationally through most state departments of health, or BRFS would be another one. BRFS would be a source that has more like adult-oriented tobacco use in your region, or potentially even by race. So then if we get to system changes here, again, the PSE strategies would be policy, system, and environmental changes. And system is kind of thinking about like how things work. What is the process to generate an outcome? So what we did for tobacco cessation was identified ways that we can kind of insert tobacco cessation into the current system, or maybe even improve the system that's in place. So the first example here is considering like an employee incentive for being tobacco free. That's something that any business can do. It can be a once a year thing. It could be maybe a day off every year if they're tobacco free and can show that to the leadership. But that would be an example of a system change that promotes tobacco cessation. Then those three, the ask, advise, refer process, building that into the health electronic health records. It's possible to get an ask to generate during like the triage process. So it's something that when a patient gets their initial vital signs checked, their blood pressure, their oxygen, here locally, they are prompted to ask about domestic violence. Alcohol use, tobacco use are a few examples. But that's that first step, is just asking, do you currently use any forms of commercial tobacco? And if it's a child, it might be, are you exposed to any forms of commercial tobacco use? Then designing a referral form for follow-up to help with the arrange process would be next, to make sure that if they are interested, that they take the necessary process to help them make that arrangement for whoever it is that's going to do the intensive tobacco cessation with them. And that could be done in electronic health records as well. There's maybe like a window that pops up once they say the patient is interested in tobacco cessation. And then tracking performance and providing feedback is important. That's going to help with knowing, is this working, and is there something that we can do to improve the system, change to the system. For example, we found out locally here, we were able to get a referral form in place. Our state quit line had a fax printout that was able to be completed and faxed into them by healthcare providers for referrals, but it wasn't getting used that often. So we worked with the CAC to have an option in the referral section of the chart, where they do their charting in the electronic health records, that says, I'm just going to do the South Dakota Quit Line referral. We found out that that referral form was very successful, that when it was just there in front of them, providers were much more willing to use it. But then we also found out there were some problems a while back where it said referral form that they're supposed to print out that form and then fax it into the quit line still. There's nothing, electronic that just magically appears on somebody else's desk at the quit line. They had to take the step of faxing that form in, and that wasn't happening because they didn't realize that was important. So at that point, we made a few tweaks in the wording and the language to encourage the providers to kind of finish that process, close the loop, and making sure that that referral form actually gets back to the quit line. So that's a good example of, tracking that performance and getting feedback from the users of whatever that system change was. And of course, troubleshooting the problems too. And then another example would be cessation medications. So if I'm not a user of Indian Health Service, I might just go to a regular pharmacy and purchase nicotine gum or a nicotine patch, or one of those medications that isn't necessarily prescribed to people, that they can just purchase on their own. It used to be at our local facility that in order to get cessation meds, even the over-the-counter ones that didn't need a prescription, the old process was that they had to get a prescription from their provider to do that. But we partnered with the pharmacist at our local IHS, who was able to kind of make that process a little bit more simple. And people could then just go to the pharmacy window and say, hey, I need some more nicotine patches, instead of having to go through a full clinic visit and get that prescription generated. So that was one system change that we just are trying to improve the access to. And you can see on the right here, this is the backside of the last screenshot that I shared that talks about smoking cessation in our community. This is really important here. It says known tobacco use that is not addressed by clinicians is perceived by patients as acceptable. So what that means is, if I just ask, if I'm a nurse at the hospital and I say, hey, do you use tobacco? I need to put this in your chart. And they say, yeah, I smoke cigarettes. And I say, okay, and I document it. And then I never say anything about it again. And the doctor comes in and he never says anything about it again. Subconsciously to that patient, that means like, oh, I told them I smoke, but they didn't say anything, so it must be okay. So that's kind of making sure that you're following all those steps of first asking, then advising, them to quit, and then referring them to whatever the appropriate system is. And you can see here, I talked previously about the codes for billing and coding purposes. They are available in here if you want to take a screenshot of this slide before I kick to the next one. Otherwise, I believe it's being recorded and you'll get the slides later. So those were system level changes. Now, if we move into environmental changes, believe it or not, smoke-free air policies can have a big impact on tobacco cessation. So that's kind of why those are included here. Anytime you can have a really strong and comprehensive policy, it's going to encourage tobacco users to quit. They might just say like, oh, it's too inconvenient. I don't like missing work or having to punch out to go on my smoke break. I'm just going to try quitting if there's enough barriers in place. So campus-wide smoke-free policies could promote that cessation. Of course, it's important to include electronic cigarettes because if you don't, what happens is all of the cigarette users will just switch to e-cigarettes because there's that loophole in the policy. And we do have evidence that e-cigarettes are harmful secondhand. So if I'm vaping and producing a big cloud of vape, people that are around me are inhaling that and also getting exposed to nicotine and chemicals from that secondhand vape cloud. Also, it's important to protect the use of traditional tobacco. In every single policy that we've ever done through the Chunli Coalition, we always have a statement that very clearly distinguishes that we support the use of traditional tobacco and encourage it, and that this smoke-free policy does not include the use of traditional tobacco in any of the policies. Having appropriate consequences for violations is important to think about. That is really going to have to be customized for your area if this is something you think about, but that's where that power versus interest grid is important, of getting all those perspectives of people who have different ranges of power and interest to make sure that whatever the consequences are determined are actually appropriate. And then signage. These are a couple examples on the right here of signs. One says this is a smoke-free area, keep tobacco sacred. The other is in the Lakota language, Chunli Umpeshni, which means no smoking. And we use some local art from a young man who's entered one of our media contests with his message. So those are two smoking signs that have been helpful. And then making sure that the policy is regularly communicated, that it's not just a one and done thing, like, oh, we have this new policy, but maybe sending emails out to all staff regularly, or having the signs is another way to have regular communication with anybody that visits the building. And then other environmental changes to mention is improving access to chinchasha. That's been something that we've kind of done all along throughout the coalition work, but we've gotten more serious about it, I guess, in the last couple of years. We started with some what we call Hazel's Chinchasha pods. Hazel was a longtime member of the Chunli Coalition who at one point came to a coalition meeting and said, I was asked to give a prayer the other day at a meeting, and I was handed a cigarette. And I accepted because that's the culture, that's what we do. And I provided the prayer, but I felt like it was a missed opportunity to provide some education on the true tradition and the practice of offering tobacco when you're asking for something. So at that point, we said, well, what can we do about this? We started improving access, I guess, to that chinchasha or traditional tobacco, where anybody that needed some could get it from one of our cultural preservation officers, and it was free to them. It's not something that they had to pay for. So that was just kind of Hazel's idea. And then we had a little brochure that talks about the kind of the education that goes with that, and what educated on the true tradition of offering chinchasha or traditional tobacco. Another thing that we've just started last spring was our chinchasha garden. If you're not familiar with chinchasha, it's not from the tobacco plant at all. It is a red willow tree, and we use the inner bark to kind of like shave off the branch, and it's used for ceremony. And this is something that grows really well along riverbeds, so it cannot, or it can be a little bit challenging for maybe an elderly person to get access to. There's also a lot of rules around harvesting, what times of year it's allowed and not, that if we can just have it right here in town, easy access, that's gonna hopefully, you know, improve the use of chinchasha instead of chunli, the traditional instead of the commercial tobacco. So that's what this photo is here. These are our plants. They eventually will continue growing and fill kind of this big ditch that we have behind our office. And at that point, we'll take the fence down and make it, you know, just free and available to the community to use however they need. Also, just giving education on how to harvest. Maybe they want to do it the old way and go to the river and have that experience with their family of harvesting together. But not a lot of families, or I shouldn't say not a lot, but not all families know that practice and how it's done. So just educating the community on how that's done can be helpful. And the big thing is with your traditional tobacco, if that's something that your tribe has, just promoting the use of traditional tobacco can really discourage the use of commercial tobacco. I've heard stories of people who became addicted to commercial tobacco during ceremony, unfortunately, because they were past it and they used it and became addicted very, very quickly. So if we're using traditional tobacco as it's meant to be, potentially we can avoid some addiction and disease in our communities. So next here we have just kind of some tips on media and using a variety of media forms to further your message when it comes to tobacco cessation or traditional tobacco promotion, if you go that route. We have done videos. There's CDC tips campaign, as well as the Intertribal Council of Michigan, both have some really nice videos on tobacco cessation. Different brochures. You have to really think about who is the target audience for each type of media and whose hands might it end up in. I don't know many teens that are going to grab a brochure off of a display case, but I think elderly are ones that kind of like to have that physical copy in their hands that they can read through. And similarly, you know, the elderly population might not be as attracted to videos versus the younger population that's just the world they know of TikTok and Instagram and all the other social media videos that are out there. Posters, of course, you know, peppering your community with good messages about cessation, digital frames. This screenshot here is from one of our digital frames. What we did is identified individuals in our community that had nice stories to tell about whatever the topic was. Maybe secondhand smoke, it might have been cessation and their story and how they quit to encourage others. But this young lady here, I'll read it if it's too small. Her story, this is just a few of them, says, "I didn't know smoking and secondhand smoke is that dangerous. Inhaling smoke can cause breathing problems to my lungs. The cigarette smell stays on my clothes for a long time. Now I ask others not to smoke around me." So what we do is buy digital frames that have just still photos that loop through. And we take these stories and break them down into very short sentences, take the pictures, load them on that frame. And then we typically put these digital frames in waiting rooms of healthcare facilities or any other waiting room. Maybe it's the secretary's office at the school that everybody passes through during back to school time. But just some location where they're very visible. We found some that the clinics like because they power down after 5 minutes of no activity. They have a little sensor on them where every time somebody walks by, it triggers it to turn on and start cycling through the photos. And then, of course, after business hours, they don't have to remember to turn it on and off every day. It just fires up as soon as somebody walks by in the morning. Other options would be newspaper articles and ads, radio programs and ads, and of course, social media. So typically we will choose maybe one topic for a given period and hit all of these different multimedia areas with very similar looking and similar sounding messages. It might be different levels of reading. It might be different amounts of content on each, depending on how it's used. But these are all great options to further your message. And then when you're thinking about locations of where to put all your multimedia, any of those departments that you identified as potential partners would be a great location to display your media. Bathrooms, this one always makes me laugh. It says some of the grossest things in this bathroom are in that vape. So that's one that's generally put on like bathroom stalls to discourage kids from vaping in like school bathrooms. Others would be, like we said, waiting rooms, on social media, scrolling LED signs. If you have one of those big screens that has messages that can scroll through, asking like, hey, can we put the quit line number in there? Or can we say, be tobacco free? Outdoors, speaking of that, this is one of our school's chain link fences where we ordered, they're called put in cups. And they're just little plastic pieces. It's maybe a bit more of an environmentally friendly way of doing like the old styrofoam cups and fences that blow out and are not good for the environment. But of course it's plastic too, so there's that. But it's a great way to get positive messages out there. And we use, we worked with our Teens Against Tobacco Use students to come up with a message in their school colors and get them up on the fence. And then prenatal packets would be another option. It's common for women who are establishing care with an OB or a midwife to get a packet of information about their pregnancy and what to expect. And that's definitely an important time to encourage tobacco cessation. So those are just some different examples. This is another poster we did with one young man. CRC Youth want you to be through with chew. And that is actually every February is Through with Chew Month. So kind of that how-to on the multimedia campaigns, you can do a contest. I am not an artist. I am not a graphic designer. I've never claimed those skills, and I don't think that I ever will in the future, but I'm surrounded by talented artists who have those skills. So what we do is frequently, every couple of years, host a contest where we say, sometimes it might be a really specific message that we're looking for. We've done contests for signs. That's where that smoke-free sign came from. And other years, we just keep it very open, that we just want any and all media about tobacco in general. Just tell us your message. So that's one great example to get some material, I guess, or content for your campaign around tobacco cessation. Ordering free materials online and disseminating them. Most departments of health, as well as maybe some tribal departments of health, are going to have messaging and things that are ready to go free of charge. You just have to submit an order and get them. If you've ever wondered, who fills those brochure containers in the clinic, be that person. Just ask and say, hey, I see there's some space available. Can we, if we ordered some tobacco cessation materials, could we use that display case to add our information to? And then sometimes it's important not only to use what's already available and free, but customizing it. So this is one example here in the center. One year for the Great American Smoke Out campaign, which is one that the American Cancer Society does every year, they had an image like this of just a close-up picture of an individual with that kind of told their story of how they quit, which was really powerful and great, but they were faces that nobody recognized in our community. So what we did was reached out to a few individuals who we knew had success quitting tobacco and featured their story. And then we used our Lakota values, which respect is one of the big Lakota values. So this message was featured on several of the posters. Love yourself, respect your family, quit today. Very short, simple, to the point. We celebrated, we celebrated Monica for 10 years of being smoke-free, and she quit cold turkey. Some of them used local facilities here, so we also included how they were successful quitting. And then a quote from her: "Stop smoking today because your family will need you later," was the statement that she gave to us when we reached out. And then this here is another example, coloring contest that we've done in the past, where we design kind of a fill in the blank message with little speech bubbles or thought bubbles from characters on the page. I gave them a message, and we get some amazingly creative and thoughtful and hilarious statements from the kids when we do these coloring contests. And we not only do the contest, but then we take the winners and share their winning entry on our Facebook page. So you can find us on Facebook at Chunli Coalition of CRST to see some more examples of more recent coloring contests that we've done. And then the last one in the multimedia campaign is booths. So this was one example of a Great American Smokeout Day where we just set up a booth at the IHS lobby. We've also gone to like the grocery store, Breezeway, to set up booths. So just thinking about where, has a nice safe place for you to get your message out can be helpful. So I don't want to take too much time because I want to save some time for questions, but I do want to share a website that you might want to bookmark that can be helpful if you finish this presentation and think like, oh, what was that she said? Or how would I go about this? I just need more information. This is, like I said at the beginning, we have this framework, and this is the website that accompanies that entire framework. So we're just gonna switch to the website here, one moment. Okay, so this is the Tribal Tobacco Advocacy Toolkit, and in it, on the front page, you'll find just some general information about how it came to be. You'll find information on the history and methods, resources and partners to consider, and then some videos that go along with the toolkit if you just need some more information or maybe you're just not sure where to start. Then you can see under community engagement, which if we go back up, sorry for the scrolling, is that big center blue piece that interconnects the education and policy work. You can see there's sections on coalition building if that's something that you need to work on, policy advocacy, raising awareness, collecting and sharing data, and then multimedia, which is a lot of the more in-depth details on some of the multimedia examples that I shared. Then education, which is that yellow section on the left-hand side of the toolkit, or I'm sorry, the framework, digs into community education at schools and doing contests. So some really detailed information. We'll just click on that one to kind of show you an example. There's just a brief introduction, some planning steps on how to execute a contest, some resources. 808 No Vape is one of my favorite sources for youth videos on vaping. Some follow-up questions and what ifs. Anything that we've learned over the course of our 12 years in existence with the Chunli Coalition, we just give you some hints on how to troubleshoot certain situations. And then we provide a real life example of how we used contests, but that exists for each of the different sections. The other parts in education are coordinating events, national events like the Great American Smokeout through a Chew, which I mentioned, having a walk and talk in your community or doing a parade float, and then giveaways. So getting kind of those resources together from national sources or local sources, and then just getting, that brochure in the pamphlet holder. And then different policy, we won't get too much in depth on the different policy section other than system changes, and a lot of what I shared in the presentation today does show up here in those system changes. Here's some nice examples of PSE changes from ACAP, the American Indian Cancer Foundation, through an Indigenous lens. That's a great resource. This is our LED board in our community here. IHS owns it, and they usually feature their schedule of like when different specialists are coming to town, but we just said like, hey, can we put the quitline information in there? And they were very willing. So it still goes today, and that's been going for several years now. Other system examples would be how to work with tobacco retailers to promote tobacco cessation or promotion, tobacco initiation by youth, excuse me. And yeah, so there's all kinds of information within this toolkit, and some good like step-by-step examples of how to execute these ideas in a good way. And of course, we encourage you to put your own flavor and your own spin on it to make it fit your community and the culture that exists in your community. So with that, I guess we will, oh, actually, sorry, I have one more slide, I believe, to finish before I open up for questions. Back to, okay, so the last thing would be treatment options. And I suspect that if you've done any of the learning series that these have been shared repeatedly, but if not, the state quit lines are a great resource for you. If you're not knowledgeable on them, learn about them. Reach out, find out what it's like, how it works, who to contact. Then evaluate their reach. Do they have a good reach within Native populations right now, or is that something that could be worked on? And then advise, and maybe if they aren't reaching the Native population, what more could they do to help reach Natives in your area? Another great resource is the American Indian Commercial Tobacco Control Program, and you can go to aiquitline.com for that. And this here is one of their flyers, but that is customized for the American Indian population, and another great resource. This is actually a poster that I believe is quite new that we printed off and hung out throughout our community to promote. And then any talking circles or support groups are a great option if you have access to healthcare, individuals who might want to lead that, or just getting people together to share their stories of how they were successful and support each other can be really helpful. Then of course, traditional healers, they can also be helpful with tobacco cessation. I think in general, they most likely will recognize that commercial tobacco is not, traditional, and that it's harmful to the body. One example for the Lakota is Chayaka tea supports sobriety. So that's something that they might be recommended to use if they're in the process of quitting tobacco. And then also ceremonial leaders, that there could be specific ceremonies to support them in sobriety and quitting. Wiping of the tears is one that we've supported in the past year. So just some different treatment options or interventions to explore in your own community. Some resources here from CDC Million Hearts Tobacco Cessation Change Package is a great one. The ALA is American Lung Association billing guide for tobacco screening and cessation if maybe your clinics just need help navigating that. The SAMHSA implementing tobacco cessation programs and substance use disorder treatment settings, and then the Keep It Sacred website through Intertribal Council of Michigan has some great resources on commercial tobacco cessation as well. So with that, I'm now finished with my slides. And Brett, did you want to open it up for questions or discussion?
Sure, thank you so much. And that was a really phenomenal presentation. It felt chock full of really fascinating information and really helpful frameworks. So yeah, let's go ahead and open it up for discussions or questions. So if you just use the raise your hand function, we'll be able to unmute you. And that way you'll be able to speak. If you prefer not to speak, you can always put your question or your comment in the chat. And we do have one that I'll read out loud while we wait for folks to formulate their thoughts. Someone said, I love connecting the students and youth with making media for this. It really speaks to the adults and connects their commercial tobacco use directly to their family and community. So yeah, I think I would agree with that. But does anyone have any? See, I don't see any hands raised, but we'll give it a minute. Rae, I particularly liked the power and interest kind of chart. I think that's very useful to think about whenever you're trying to make systems change around like who are the people that have ability to push either the tribe or whatever system you're working within in the direction that you want. So I think that that's a kind of a helpful framework that I might be using for some other areas too.
Yeah, I've definitely written all areas of my work. It's super important because oftentimes when you frame it like that, you think of people that you wouldn't have otherwise identified, that maybe they have no interest or no power, but hey, they need to be at the table. Parents, for example, or like when we were doing our smoke-free policy work, the businesses, you know, they're definitely interested in if this policy happens or not, but what's going to work for them. So it definitely uncovers some unsuspecting partners when you use that.
And we do have a question from Emma. Do you have any other best practices or resources for collecting community level information on tobacco use? So do you have any thoughts there?
Yeah, that's a really good question. Thank you, Emma. I would say probably the best place to start might be your regional epidemiology center. The United States is made up of, I think, 8 different regions for the Indian Health Service, and each of those regions has a designated epidemiology center that generally, if there's been efforts to collect community level data, that they're going to have it. And usually there's a process to go through in order to obtain that information, but that'd be a great place to start. And if you do go to the, let me just stop my share here. If you go to the Toolkit website that I shared, which I can put in the chat box here, there's resources section on the main page that would have some other links and ideas where you can find maybe the contact information for the epicenter that serves your region. Otherwise, I think that reaching out to the GIPRA team, again, we kind of started with that. Whoever the tobacco cessation GIPRA coordinator is for your area might have access to some community level data. And the other option is if you don't come up with anything, you can collect it. You can do a really simple volunteer survey at the grocery store to say like, hey, can you just tell me, do you use tobacco? Are you exposed to tobacco? What types have you used? It can be very informal and give you kind of just a sample of maybe what's happening in your community. And there is a section on collecting data in the toolkit as well.
Awesome, thank you. So we have Sam Stevens who would like to ask a question, and then after that we have a couple of questions in the chat as well. So Sam, you should be able to unmute yourself and ask your question now.
All right, just had a question for Rae. How can tribal councils support state bills that are at legislature on tobacco use?
Yeah, that's a really good question, Sam. As I said in the presentation, of course, due to tribal sovereignty of at least the federally recognized tribes, state laws wouldn't apply. So some council reps might be a little bit discouraged from reaching out, but I definitely think it's important, especially if it's something that can support them with their own tribal government. Maybe the tribe already has a smoke-free policy, and it would help if the state got on board and did theirs as well. So there's kind of no jurisdiction issues just across the board. It's all smoke-free. But I definitely think anytime that anyone in government is working collaboratively rather than against each other, it's going to make for stronger connections and better policies. So I think maybe just pitching the value of reaching out if they're a council member to maybe a state representative, and even looking up whoever the representatives are in your region can be helpful, because they would be somebody that has maybe more of a listening ear to the needs or circumstances of tribal policy.
Yeah, and I'll just add, National Indian Health Board can also be helpful for that, especially if you're talking about federal issues. feel free to engage with NIHB on that front as well. We work with Congress and the administration quite frequently, and we do engage in a few state issues in collaboration with our area partners. Okay, I do have kind of similar question from Kathy. Could you talk about the policy process, including how the policy language was developed? I think they mean at the tribal level for Cheyenne River, I think. Correct me if I'm wrong, Kathy.
Yeah, the policy process, including how policy language was developed. Absolutely. So in the toolkit, again, back to that, that's where everything is housed if we have a resource or there information to share. Kind of the steps, I guess, that we followed overall would be first to engage the stakeholders. So reaching out to whoever the decision makers are, if that's your tribal chairman or president or council representatives, district representatives, however it's split up, engaging with them to have those one-on-one conversations. And then after that, drafting and revising the policy. And as I said, we worked really closely with the Public Health Law Center. We kind of gave them, here's the deal breakers, things that we really have to have in the policy that we're not willing to negotiate on. And here's things that we'd like that aren't such so critical. And then we also have some model policies, both for smoke-free tribes, smoke-free parks, smoke-free schools. There's a variety of model policies that you can kind of just lift the language out of and copy and paste. We are all about sharing with the Chunley Coalition. We want others to be able to benefit from the work that we've done, so it doesn't take other tribes quite as long as it did us being on kind of the frontiers, I guess, in this space of advocating for tobacco policy changes. And then after the policy is drafted, then we move into presenting that policy to council. And then if it's passed, then moving into implementing the policy and defending the policy in case there's threats. So those are kind of the sections that you can click around in the toolkit that will hopefully give you more information if my question or my answer didn't answer your question.
Yeah, and Kathy says, great, thank you. And let's see, we have a couple more comments in the chat. Oh, Chrissy wants to know, would you be willing to share your new team member packets for staff and providers with the folks who registered?
Yeah, I think they're very customized to our area. So I don't know how they'd be, how helpful that they would be, but it definitely would be an example of something that you could customize for your area as well. And we also have a video that we did in past years. We always did in-person trainings where we provide a quick, homemade soup lunch for our providers to come in and learn about our, whether that's new faculty or existing staff that need that message. And this year, with COVID, we opted to do it on video. So I could certainly share that as well. Maybe Chrissy, if you got my email address from the slides, you can reach out to me with a separate email and I can respond to that request.
Yeah, and if you have any other materials that you want to send out to the group, we are happy to send it out to everyone who came on the webinar. And I'm doing a quick scan of the chat because we are at the end of our time together. It is the top of the hour. I do just want to note Alaska has a draft policy that's tobacco-free and vape-free for Native tribes to adapt and adopt. So that may be something interest to Alaska. But since we are at the top of at the end of our time together at the top of the hour, I do want to be respectful of everyone's time. And so Rae, is there anything you want to say in closing?
Just thank you, I guess, for your time and good luck. It's hard work, but it's rewarding work. If you can even get one person to quit smoking, you've done a great job and probably impacted that person for the rest of their life. So keep up the good work. Absolutely.
And thank you, Rae, so much for joining us today and providing your wealth of knowledge and your time with us today. I did put a link to the evaluation I mentioned in the chat, and we're going to also send a link out later on with the materials Rae mentioned, but do please take 2 minutes to fill out that evaluation. It's very helpful for us at NIHB. And please join me in thanking Rae for her wonderful presentation. And with that, I hope you all have a good rest of your day and a good rest of your week. Thank you so much.